You're looking there at the Diamond Princess. These images courtesy of our CBC News crew there in Yokohama. And any minute now, we expect to see some 200 Canadians start to walk down a gangway and right off the ship. The Diamond Princess docked, as it has been for weeks now, in Yokohama, Japan. The Canadians are finally going to be heading ashore for an airlift out of Tokyo that Ottawa has organized. They've spent the last 15 days in quarantine on board that ship, in their cabins, caught up in the world's biggest coronavirus outbreak outside mainland China. It's an outbreak that just keeps growing. Japanese officials just last hour confirming 13 new infections on board, bringing the overall number on the ship to 634. Here's a picture of some of the people the Canadians have been meeting. A nurse and a doctor. You can't really tell in their extensive protective gear, but both men. And this is a picture that a couple of Canadians whom you've met already on our program, Lolita and Hans Wiesner from Joffrey, Alberta. They posted that on Facebook. They have been in to screen the Wiesners and to make sure that they're okay. And Lolita tells us that she and her husband have both been cleared for the flight back to Canada. We know at least 47 Canadians have been diagnosed with COVID-19 and will not be allowed to make that trip. We have extensive coverage of the story for you again as we await the first images of Canadians coming off that ship. The person who's going to see it close up for us is our Asia correspondent Sasha Petrusik in Yokohama, as he has been for the past few days. And Sasha, you're right there in position to see the Canadians after their flight checks. We should start to see them coming off the ship.
We should, Heather. The process has started. I've been talking to some of them on board. They've been calling them in different groups, color-coded groups. The green group, if you're interested, has just been called. The yellow group is waiting to come out next. They're going to be pulled together, put onto these buses. There's about a dozen buses, it looks like, sitting in front of the ship. Then they're going to drive about 20 minutes, half an hour to the Tokyo Haneda Airport, which is just down the road, and put onto that Canadian charter, which is sitting on the tarmac, has been for a little over 24 hours now, waiting for the Canadians to get off the ship. Once they get to Canada, they're landing in Trenton, Ontario. Then they face another 14 days of quarantine there. That's actually going to be in Cornwall, Ontario, down the road. And so this process, this whole journey, this trip, which has already taken many of them a month and a half, is going to continue. And, you know, it sounds very arduous, but the people I've talked to are actually looking forward to it. They're looking forward to a change of scene and what they consider to be a safer environment because, of course, on board they feel that it is quite dangerous at every moment that somebody could get sick and that these viruses, which are all over the ship, could in fact infect them.
And I want to come back to that point in just a second. As you mentioned, Sasha, the Canadians excited to get off the ship. We've been hearing and getting emails from some of the passengers, and one couple ended their email to us with simply a hooray. They can't wait to get going, as you suggest. So they are going to be coming off the ship. But I just mentioned that the latest numbers we have from the Canadian government, Sasha, is that 47 Canadians at least have been diagnosed with COVID-19. So they're not going to be allowed on this evacuation flight. What will happen to them?
Well, that's already happening to most of them. They are in Japanese hospitals, in other healthcare facilities. You know, many of them are actually not showing any symptoms. In fact, it was a surprise to them that they tested positive. So for them, they're basically being observed, they're being watched, and they're being tested. And eventually, if the tests come back the right way, they will be allowed to simply walk out the door and leave Japan. And of course, what happens in Canada is still a little up in the air with them. Others are a little more serious. They are actually being treated. That's a bit experimental still. This virus is a bit of a mystery to many people still. So, you know, what they're being treated with, the medication and the treatments themselves are a bit hit and miss. So it's not clear how long that is going to take. In any case, all of these Canadians, these 47 that you mentioned, and perhaps some new ones that we haven't heard about, will in fact be in the Japanese healthcare system for a little while. I want to tell you, though, that this has been a very serious situation. We've watched the numbers here grow well over 600 total of the number of people who have been infected on board this ship over the past 2 weeks. That's gone from one person to over 600. So pretty dramatic leap. And today we found out that 2 Japanese people, a man and a woman, were the first to die from the virus. They tested positive about a week and a half ago. They've been in hospital since, and they passed away this morning, actually. What we know about them is that they're both in their 80s. They both had other health issues, so they were vulnerable or considered to be in that group. But it is certainly a step up for this whole situation.
Okay. Sasha, just one more point, because I'm interested in your perspective on this. You mentioned the numbers that started so small and have just exploded to what is the highest concentration of coronavirus cases outside mainland China. We've been hearing in recent days, particularly from health experts who've expressed concern about how Japan has handled the situation on this cruise ship, that it's been chaotic, that it didn't protect the passengers. As you're there, what are you hearing and observing in terms of how Japan has handled this?
Well, I think they have taken a page from China's book, in a sense, and just simply decided that if you've got somebody with the virus, you close everything off, you draw a circle around it, and you don't let anybody in or out. That's what we've been seeing in Wuhan and in other places in China, and that's what Japan decided to do on a much smaller scale here. The problem is, according to experts, that you're lumping together all of these people who are sick with people who are well. The virus is moving around. We've been hearing from Japanese experts who've gone in here, and they've said that there's no separation between, areas that are clean and areas that are dirty, areas that have the virus and don't, and people who are sick and people who could be sick and people who aren't sick. So that's why we've seen this explosion in terms of numbers. The virus is just rampant through that ship, clearly, from what we've been seeing. The Japanese government has been criticized for that. Today they came out and they said that they think that they have done the right thing, that they've handled this properly, that there's no problem here, that it's a difficult situation, but this is the best that they could do. A lot of experts are saying we're going to learn some things from here about what not to do the next time around.
Sasha, thank you very much. Sasha, right there on the pier with the Diamond Princess behind him. He's there to see those Canadians as they start coming off the ship. We expect this hour, and we'll be back to Sasha for more updates as we continue to track that.